First of all, good morning, everyone, and thank you for having us today. We very much appreciate the time that we want to that we're spending with you today, and also our ability to sort of kick off the second day of this important workshop. I'm Lisa Kaplan. I'm Senior Vice President of Care Delivery Technology Services for Kaiser Permanente. And what that means is I have oversight of the technologies that support the care delivery and the clinical operations across Kaiser Permanente. This includes our electronic health record, our lab systems, pharmacy systems, medical imaging, health information exchange, all those fun things, and others that really help our hospitals and medical office buildings operate. I'm joined today by Ash Tenchi and Jack Z, who will be sharing more information about workflow and robotic process automation at Kaiser Permanente. So I'd like to pause here for a moment and give Ash and Jack a moment to introduce themselves. So Ash, do you want to introduce yourself?
Yes, thank you, Lisa, and good morning or good afternoon, everyone. I report into Lisa Kaplan, and as Lisa said, she has a very broad suite of applications for care delivery. I lead the engineering functions to deliver those applications. So I'll keep that short to that. Thank you, and glad to be here. And Jack, do you want to introduce yourself?
Good morning, everyone. My name is Jack Z. I'm part of the IT organization. I'm in a group called KP Digital under our Chief Digital Officer. And I have accountability for enablement of a lot of our digital capabilities. And one of them today we'll talk about is RPA.
Great. Well, thanks to you both. So we have a lot of ground to cover this morning, so we wanted to make sure we have plenty of time to present, but also to answer any questions that you might have. I'm going to start by talking a little bit about Kaiser Permanente, a little bit about our history, our operating model for those of you who are unfamiliar with it, some of our metrics, particularly related to why automation is important to us. And then I'll turn it over to Ash and Jack, and they'll go into the deep dive details. So if we go to the next slide, a little bit about the KP framework. 75 years ago, Kaiser Permanente was really built upon the idea put forward by industrialist Henry J. Kaiser and Dr. Sidney Garfield about providing healthcare in a prepaid way, not just for the construction workers and their families who were working on the Grand Coulee Dam construction. It was really far away from anything, and they felt like being able to provide healthcare to that entire community locally was important, and to also think about preventive care to help people stay healthy, to obviously render services when they need care. But that was really kind of how Kaiser Permanente started. And the idea of providing comprehensive care and covering a community of people, really led to Kaiser Permanente, which now serves over 12 million members across the US, and still views the communities that we operate in, really as part of our mission, as you can see on the top of the slide. Our goal is that we have, we help people, have more healthy years to play, learn, to work, and to love. It's just as simple as that. Kaiser Permanente is really a set of organizations as an umbrella, if you will, that covers really three distinct entities that partner together to provide services. The first entity is Kaiser Foundation Health Plan, which is really the insurance arm of Kaiser Permanente, which our members enroll in. The second leg is Kaiser Foundation Hospitals. There's 39 hospitals across KP, and this leg helps us to arrange hospital care for members needing it, including outside of our service areas. And the third leg of our stool is our 8 Permanente medical groups that provide medical services in each of our markets that we operate in. And we have over 23,000 physicians on our team. If we want to go to the next slide, Automation, is really important to us. Because our operations are very large and geographically distributed, we want to provide our members and our teams really high quality and efficient service. Kaiser Permanente has made a significant investment in automating manual and repetitive tasks that impact many aspects of our organization, and we're going to talk about those in more detail. But thanks to all this work, we've been able to save over 91,000 labor hours across 25 processes, and those numbers continue to grow every year. For example, we leveraged automation to reduce clinician fatigue by making the shift handoff process easier and by developing toolbars that automate routine functions within KP Health Connect, which is our electronic medical record. Additionally, multiple back-end and operational tasks within human resources, like internal bidding for jobs, and even within our own information technology team, using automation to automate server provisioning across our organization. So those are just some examples, where we've used rapid process automation to facilitate our operations and service. We've also worked to reduce manual data entry requirements and support automation in other areas like supply chain, materials management, inventory, health plan, administrative processes, and other things not listed on this slide. And, we've also invested quite a bit in piloting around machine learning pilots for things like call center sentiment analysis, flu prediction, and length of stay prediction. So these really serve as a launching pad for us for even more use cases. Our goal here really is to help us make informed decisions, to provide the best quality of care and the most efficient operations and the best member service that we can. If you want to go to the next slide. So how are we making an impact? Well, we kind of pulled some numbers here just to give you an idea of the scale of our operations and how automation has really helped us do that. So much of healthcare is really dependent upon accurate and timely delivery of information. So it's really important that we have efficient and effective processes in order to support that, particularly when you're handling, the volume of data, that we handle. So this slide shows a few examples, of that scale and how we've used automation to support some really important functions for us. So for example, automation has helped us really improve communication between our members and our care staff. We see that as a vital function. We want people to talk to each other. We want to know when people aren't feeling well. We want to know, even if it may not seem that important, oftentimes it is important. Sometimes it's a simple thing, like I have the flu, but sometimes it's an indicator of something more significant. And we want to be able to foster that communication back and forth. We also want to make sure our members can manage their prescriptions, their medications, can see their lab results as quickly as possible. We try to do that same day. If I have a fairly routine test in the morning, I want to be able to see my results in the afternoon. I don't want to have to rely on mail to do that. I don't have to wait 3 days. I want to just get it, right away. And it also, the automation that we've implemented helps us to identify patients who may not be sticking to their care plans. And we want to know that. We want to help them. We want to understand why that's not happening. And we can't do that without automation. So as you see, on these slides, in 2019, automation helped us really, grow our appointment scheduling by 27%, our prescription refills, by 11%, our lab tests, by 13% in terms of people being able to see data. We've also gained a lot of efficiencies and grown quite a bit, thanks to the automation we've implemented, but we also have to manage that, very thoughtfully and carefully to make sure we're applying automation and intelligence, to the right things at the right time. So if we want to go to the next slide. It's funny, automation is such a beautiful thing. It can be so helpful in so many ways. But we also need to be mindful, that capabilities like RPA, bots, AI and other tools, we have to think about them strategically, and thoughtfully. We don't want to do stuff just to do stuff. It doesn't make sense. So we kind of think about it, those technologies as kind of our non-human workforce. They augment the wonderful people of Kaiser Permanente. But, we also realize is that they need the same level of attention, that our traditional workforce does. And, as technologists, as scientists, and others, we're really their HR officers, as they do their work for our organization. The algorithms are just not lines of code, they're active contributors, to help us deliver, on our mission and objectives. This means we have to be very strategic, about how we implement them. We need to set up policies and protocols to help us measure and gauge their performance, similar to the way we perform performance evaluations on employees. We want to make sure that they're doing things in the right way and in the way that we intend them and direct them to do. So it really provides us really a fabulous opportunity to bring together data science, ethics, integrity, technology, values, and I would argue maybe a little bit of parenting, to apply them in a manner that allows us to learn and grow together with these technologies. So with that, I'd like to turn the presentation over to Ash, who'll be sharing some examples of how we utilize workflow automation here at Kaiser Permanente. So Ash, you want to take it away?
Absolutely. Thank you, Lisa. And, I'm getting an echo, but I think, okay, it's all good. All right. So I have, as Lisa talked about, we just have a very wide canvas to work with at Kaiser Permanente. And so I'm going to go over about 7 or 8 examples. And because it's 7 or 8 examples, and I started the timer here, I just have about 15 minutes. I'm going to have to breeze through some of these. So my request to you is these are going to be just sound bites or a few high-level information bites. And if anybody is interested in more, we can either address it in Q&A or we can offline. Certainly, I'd be happy to work with any of you on these. So with that, we can go to the next slide, please. All right. So the first one I wanted to talk about was, as we all know, we still are not out of the woods and as far as COVID is concerned. And so when the COVID crisis hit, one of the things that we had to do a lot of things, by the way. There's at least, as I lead an engineering team, we had 30, 40 requests fly in about different things. But this particular one I wanted to point out, this was a need to create 40,000 new beds. As we were increasing capacity, we had to add beds, and these beds had to be added in the system. To add each bed in the system is a 100-step process. And so with 40,000 beds, it's a 4 million step effort. And so when we looked at it, we had done it manually all till today, till 2020, not today, but till March, we had done it manually. And so we were looking at 4 million steps, and just basic math, we thought this is going to be 15 people working almost for a month, 20, 30 days to get this done. But we looked at what can automation do for us. So we looked at a RPA tool, and we started working on, can these steps be automated? Well, I'll just go to the punchline. All 100 steps could be automated. So it was 100% automation was possible. And we ran this in, once we automated them in a few days, we ran this in a few hours. And so the labor was reduced from thousands of hours to 30 hours. And we have this capability going forward for whenever we want to add beds. So this was out of a need or necessity as COVID hit, but it helped us create a really good capability we can use in the future. So next slide, please. I want to talk about a couple, or actually a few examples in pharmacy. And so pharmacy overall, we dispense about 300,000 prescriptions a day. 150,000 prescriptions out of those are mail ordered, delivered to the member's home for no charge. And so we have a lot of work going on in pharmacy, and I wanted to talk about a few examples. One is the outpatient inventory program. So until last year, we had manual inventory processes, and so it was manual tracking of inventory at the store. It resulted in overstocking or understocking, and also expensive prescriptions or medications would sit on the shelves for a long time, and it would be wasted money and doesn't serve our affordability agenda. And also lastly, the suspicious order tracking. So if there was some irregularity in how many drugs are being ordered where, that was somewhat done through manual auditing processes. So we implemented this outpatient inventory program, and it automated how inventory tracking was done. We send a daily dispense data to a third party that's FDA approved. The third party sends us predictions on what needs to be ordered in which pharmacy. It also sends us information if we have expensive prescriptions that haven't been ordered or utilized in a while, so that we could potentially return them. And also it helps us track suspicious orders if at all that is happening. So all that was implemented, and we just have fabulous results in terms of the cost savings. It's in the millions of dollars on this one. And so this was a really good use of automation from inventory tracking, something that maybe e-commerce merchants have been using for a while, but in healthcare, this was a new thing. The next one is actually a little more exciting from a clinical outcome perspective for me, is the outpatient clinical services. And this is where we are looking at the true power of an integrated health system. And we want to use each interaction with Kaiser Permanente as a total health experience. And with this, what we wanted to do was, as members interact more with pharmacy than with their doctors, what we wanted to use this pharmacy interactions to find members that need consultation because there is either lack of adherence, or they haven't completed their labs for let's say. So we wanted to find members who were due for either an appointment, labs, shots, or it could be medication adherence type information. And so for each prescription that gets dispensed, we have a program that looks at their total health, their lab data, their appointment data, etc., and alerts the pharmacist that this member may need a consultation to improve their total health. And so, so we had, just talking about June, for example, last month, we had 9,000 alerts for blood pressure related consultations, 6,000 alerts for diabetes consultations. And so every month we are doing thousands of these, I would say, clinical, and that's why it's called clinical services, just above and beyond what a regular pharmacy does. And we're really proud of that, and it's showing really good results. Next slide, please. So I'll cover this briefly. This is our 150,000 mail order prescriptions that we deliver. This uses robots. Our mail order facilities in multiple regions, they use robots, and this automates our fill step. So either mail orders or any non-urgent prescriptions in the pharmacy, they get sent to this central fill plants, or think of it as bottling plants, but with much more regulation, I guess. So they come to these mail order automation robots, and again, like I said, 100,000 plus of these prescription bottles, medications are filled, and they're delivered to our members free of charge, resulting in 25 to 40% cost savings for us, and it's again free for the member. free delivery for the member. Local automation, this is our tinier robots, and these are in our pharmacies. And these tinier robots fill about 20 to 30,000 prescriptions a day. And these, again, help our operations in terms of lower cost to fill, but also a faster turnaround time. And so we can help our members better. Next slide, please. So I'm coming to a couple of AI examples. Some of this is work in progress. The first one is patient panel balancing in Southern California. What we are doing here is we are using algorithm-based panel balancing. And so the algorithm, as new members need to be assigned panels of providers, the algorithm looks at different factors such as gender, age, and some other factors, and recommends the right member to the right provider panel. And so this has been operational for about a year, I would say. And we have seen the assignment time has reduced by 26% for these panel assignments. And we have had 32,000 new members assigned through these panels, through this algorithm-based recommendations. And we are seeing about approximately a 20% better convergence towards the market goals for Southern California. So this is definitely work in progress. And if we are evaluating the results carefully, and the more we can do this, the faster we can assign panels and help people get the care they need. So next one is, this is the kind of the holy grail for, I would say the second one is really the holy grail for EMRs or providers, because today providers spend a lot of time with documentation, charting, etc. Some of them work late hours, nights to do that. And so the EMR, as wonderful as it has been, an RKP Health Connect, for example, in Kaiser Permanente, it's also takes up a lot of our physician time. And so this effort is to really look at voice assistance, AI, and ambient conversations to see how much of that can we capture, how much of that can we document in the EMR, and reduce the physician labor or physician active steps that a physician has to do to input all this documentation and charting into the EMR. Again, this is an early stage work, but our idea is that we plan to have some pilots going, and with these pilots we'll learn, and then we'll find what works for us. Like Lisa said, we have to be thoughtful about automation. And so this is one of those things where we have to be thoughtful, but at the same time, there is a large reward waiting on the other side. So next slide, please. I know I'm approaching, I have my timer going, and I think I'm approaching 3.5 minutes left. So try to do it a little, breeze through some of these. KPADs, this is our clinical contact center application. We have about 5,000 agents as well as advised nurses combined, handling calls in both our regions, in all our regions. And we get 2 to 3 million calls a month to our appointment call centers. These are for either getting an appointment or for advice on some symptom that the member may be facing and what should their next action be in terms of seeking care. Today, or before this, or actually today, we have, based on different symptoms, it pulls up triage options, and an agent has to go through all the triage questions one by one. Sometimes that ends up being 15 questions. And what this effort, again, this is a proof of concept effort. What we did was work on seeing how we can use AI, machine learning to, for example, if a member has called us, 10 times in the past 2 years, and 9 out of the 10 times it has been a particular issue, then it actually gives a lot of insight that this is a recurring issue for the member, and maybe that should help us diagnose better. But the way it is coded today, it's almost like a new interaction every time, right? And so what we wanted to do was use some AI and machine learning to kind of build that intelligence in to reduce the call handling time, reduce the number of questions we ask to our members, improve their satisfaction. Sometimes, a member could call us 3 days, he has an issue. We tell them to go see the doctor. 3 days later, they call us because they still have that issue, and we'll ask them the same 20 questions. And that is not a satisfier. So our idea is how do we improve that satisfaction level as well as make us more efficient. So that's the KPAT's work. And then colorectal cancer screening, this was a really good work done as well. Again, in progress work, but this identifies candidates who come into scope for colorectal cancer screening. Example, they may be 50 years or plus in age. It uses IVR to send, to call them, to explain them what this colorectal cancer screening is, get them enrolled to come and do the test. And no, actually we send the kits to them and they send it back. So approximately, we have sent in 2019, so this is last year's result. We have sent 87,000 kits. We got 51% kits returned to us, and out of which we found about 2,000 members who required a follow-up colonoscopy. So as you can think of, every life saved is a big achievement. These 20,000 members were proactively identified to get the colonoscopy done and save lives. Next slide, please. I'll be very brief about this, but as we are also using automation for improving our clinician experiences, as I just talked about in the previous few slides, we are also using a lot of automation to improve our delivery of our applications. So we are using our automation in the way we develop the applications, in the way we test applications, and we are seeing a lot of benefit. I won't go through a lot of it, but sometimes a large application that we would take 3 months to test, with automation, we have been able to reduce that to just about 2 weeks. And so that gets us very important features that are required by our members and clinicians out to the members and clinicians months earlier, which is again saving lives. Next slide, please. I know I'm over 15 minutes, so I won't go through all of these lessons learned, but what I would say is a couple of things I would point out here is going back to the first example on creating beds, we had done it manually the same way for years, probably decades. And so sometimes you just have to pause the next time you do something and say, is there a different way to do this? Because maybe there's new technology or new processes. The other thing I would point out is while we are all busy delivering care or whatever our role may be, who is scanning this marketplace to see what else is available? So utilize centers of excellence. Jack is going to talk about that, and so please, I would say you look for that, because that gives some focus on people looking for these capabilities. And then the last one I would say is, Lisa talked about this, but as many of you may know, ethical AI, explainable AI, those are big fields of study, as well as very important, because with what's happening, especially in the world, I think it's more important that the automation does not follow the biases of the previous decisions that were made by humans. And so the automation needs to be as unbiased as possible, and that requires very careful observation, fine-tuning, etc. So not everything can be automated, but when we automate something, especially when it gets to AI, ML, etc., it needs a careful, watchful eye in terms of how the results are being fair. So with that, this was my section. I'll turn it over to Jack, and then I'll be there. I'll hang around for questions at the end with the panel.
Thank you, Ash. Thank you so much. I just want to let you know, Ash, that even through COVID-19, the automation is working, because I got my colon kit about a month ago. I took it, and in 2 days, I actually got my test results. So it works really, really well.
Nice.
So thank you. So today I have the pleasure of talking about robotic process automation, or RPA. And so today I'm going to kind of give overview of what we're doing at Kaiser Permanente, and then dive deeper into 2 use cases. And like Ash, I'll talk a little bit about lessons learned in our future state where we're going to go. So let me know if you can't hear me, and thank you, Lisa. So let me just start with what is robotic process automation. It's not what Ash talked about, what we're using in pharmacy, where it's a physical robot that's doing actual work. These are software robots that we are programming, that you're giving instructions to on how to do things on your desktop. So if you think about the software bots, they're able to open up applications, they're able to look at data, they're able to apply some kind of logic to then put into another application. So it can open up multiple applications, apply some logic. Again, the logic has to be very structured, well-defined. And I like the analogy that Lisa did during her opening. We actually build the bots, we teach the bots like we do with our new employees. And over time, we have to continue to do the care and feeding. We have to continue to maintain it. We have to continue to develop them and continue to teach them new things as we actually mature our workflow as well. And then more importantly, I think this is kind of smart that Lisa said that, there's parenting involved, the monitoring. And this is, I think, what's going to be key to some of you is, how are we monitoring it? What are we doing from a SOC standpoint? What are we doing to ensure that the bot's doing only what it's supposed to be doing and nothing more? So I'll talk a little bit about that as well today. So a couple of things I just want to share with you. There's a couple of types of bots that we're implementing at Kaiser. One is what we call assisted bots. So these are very interactive, where you may have a user that actually talks and that requires some thinking and doing just different things. And then they will initiate the bot to actually automate the rest of the workflow. And there's several cases where it does require a very complex interaction, where there may be cases where the process is not as well defined, so it requires that user intervention. The other kind of bots that we have are unassisted. And these are actually majority of our bots. And these are where we can run it 24/7. We can run it every 5 minutes. We can run it 3 o'clock in the morning, depending on the application, depending on the transaction types. And these are more, we're optimized, meaning that we're trying to automate as much of the workflow steps as much as possible. Today, I would say we're automating about 70% of those steps based on the 70 plus projects that we've been working on. One of the things that if you look at the future, we're talking more about how do we now leverage, as Ash talked about, artificial intelligence and machine learning. As the processes and the workflow gets more complex, how do we now leverage AI and machine learning, especially, so that the bots are constantly learning? So now, instead of it just handling very well-defined processes, how can it learn from exception cases? Because there will always be some kind of exception cases where the bot may handle 80 or 70 to 80% of it now. How can it learn about those exception cases and be able to automate that on its own as well? So that's kind of the future state that we're looking at. So one of the things that we're also thinking about, if you go to the next slide, let me start drilling down into the specific use case. This first one is an HR use case, and it's specifically around for our union labor employees, where we do have job postings. And each of these job postings have an agreement between KP and the specific various unions around what skills are required, the years of experience, and a bunch of different things that we look at. And basically the manual process today is we have a recruiter that will basically go into our Taleo system, which is our applicant tracking system, to pull out all of the applications for each of the posting. And they would then go into our HR system to pull what years of experience, where they're physically located at, other various attributes that were agreed on for the job posting. And they would take a look at that, and they would actually go through and complete the spreadsheet and rank where the individual applicants are compared to the job posting. And at the end of the day, they would then send the hiring manager, here's their ranking from 1 to X of all the different applicants who have applied to that job requisition. So with RPA, what we were able to do was to actually automate this process, or a majority of this process, where we had the bot, the software bot, that will actually go into the different systems, pull out all the requisitions, then go into our our HR system, pull out all the applicants that applied, and be able to then do the physical ranking and create this Excel spreadsheet. The one manual step we did add when we automated this was the actual verification of, from the recruiter, to ensure that whoever we nominated, the ranking, everything was validated before we send it off to the HR recruiter. As you can tell, one of the major benefits that we're really able to realize, the manual process was taking 31 minutes to 55 minutes per requisition, because in each site there could potentially be 5 up to 200 applicants for each of these requisitions. So it took a lot of time, and it took a lot of effort to actually go through them, rank them, and then get them to the HR manager. Again, with the automation, we were able to reduce it significantly, where on average, it was averaging between 4 to 20 minutes. And the 20 minutes is, again, when you have the larger number of applications, like 200 of them, that have to be reviewed. So those are pretty significant benefits of actually using RPA. There are other benefits, of course. Now you have an HR recruiter that can actually handle more value and do other things. But more importantly, now we're able to actually get the applications to the hiring manager a lot faster, so they can actually to review it quickly and then do the hiring. So the average of filling a position went from 2 to 3 weeks to 2 to 3 days. So it's pretty significant in what the benefits that we realize with automation. So if you go to the next slide, let me go a little bit into some of the other, some of the other metrics just for this process. Again, on average, we were averaging about 30,000 plus requisitions. Again, it averaged between 31 to 55 minutes. And you can tell by region, it differed because of the number of requisitions, number of applications that they were getting. And we estimated, based on an annual basis, it took about 21,000 hours, or 12 or almost 13 FTEs across all of these different regions. With the robotic process automation, we were able to reduce it by 15,000 hours, almost 9 FTEs headcount. Again, we didn't reduce the headcounts, but what we did was we actually provided more improved productivity, improve different areas of the service. So that's one use case. And so let me go on to our second use case. So if you go on to the next slide. So this one is actually a little bit different. This is around capturing the charges. So anytime a patient comes into a KP facility and they get either an infusion or injection, they're properly coded in our our KP Health Connect system, or our EMR system. And part of what this process was doing, it was taking all of these codes that have been coded in our EMR system and going through them. So if you can imagine an individual, so these would be nurses who actually go in to the EMR system. For each patient, they would click through and identify all of the codes that have been coded for infusion, injections, and then basically doing some verification. If there's any errors, they will remove them. If they were incorrectly coded, they would correct them. So all of that was done manually. And as you can tell, just from that manual process, for each person, each patient, it took about 11 minutes of that nurse's time. That means it took 11 minutes from that nurse's time to be actually doing more patient-facing type of service delivery. So one of the things that we did was we automated this process. And as you can tell, we were able to automate majority of the process flow. And with that, you can see that it went from 11 minutes to under a minute for each of these processing time. Again, the benefit of doing this automation, we were able to reduce not only the time, but more importantly, it actually helped us improve the quality as well. Because you think about it, the logic that was used to identify how the coding was incorrect or correct, now it's all programmed in, it's consistent. We're consistently applying the same logic over and over and over again. So there's no potential for human error. So again, the accuracy goes up, which means the billing of the accuracy goes up, which means now you have improved member satisfaction as well. Because now they're not getting incorrect billing. They don't have to call in to try to correct that, which takes time as well. So again, not only cycle time was improved, quality was improved, productivity was improved, and also member satisfaction. So those are just a couple examples of what RPA can do. If we go to the next slide, again, just a summary of some of the gains that we did. So as part of what we measure was on an annual basis, there were 830,000 of these types of transactions, and this is only in our Northern California market. This is going into production in NCAL, I believe, in 2 weeks. So once it's in NCAL, we will actually share this with our other markets and see how we can utilize in like our Southern Cal market and other regions. Again, we calculate about 11 minutes on average. So this equated to about 22,000 hours or 11 FTEs to do this manual process. With RPA, because we were able to automate a lot of this, there's still, again, a manual process to verify things, but we were able to reduce it by over 10,000 hours, which again equated to about 5 FTEs of estimated savings. So again, really good around productivity, around the benefits of seeing that. So let's, if you go to the next slide, I want to talk a little bit more now about some of the lessons learned. I think Ash was covering some that, he talked about earlier around, like the COE. So one of the things I did not mention earlier that we do have an RPA COE or Center of Excellence. We partner very closely with our Enterprise Shared Services organization. And we also partner very closely with, our IT partners, with our business partners like claims, revenue cycle, and HR, especially around how do we now utilize these bots. So I'm going to not go through each of these, but as you can tell, what you see on the screen are basically the steps that we go through, kind of a software delivery methodology from discovery all the way to go live. And I've identified different, again, things that we learned in the last 2 to 3 years around using RPA as a tool. I'm going to highlight 3 things. One is something, again, that both Ash and Lisa talked about. I think in Lisa's opening, she talked about automation at the right place at the right time. And so I'm going to talk a little bit about, if there are times where RPA is just not a good candidate to automate our workflow. And let me give you some examples. One is, if there are already backend APIs that are already available. I think Ash probably utilized a lot of those for his automation. Don't use RPA, use those APIs. And the reasoning is because you can actually deliver that faster, cheaper, and it'll be more reliable, meaning that those APIs are part of the application. If the application changes, that API will change as well. So the automation will continue to function properly. With RPA, if the application UI changes or logic changes, you're going to have to, again, the care and feeding of the bot, you're going to have to go back in and make sure you retest it, make changes if appropriate, and then retest it again. So those are, again, one example of RPA may not be a good candidate. Another example is if the workflow itself is very dynamic, meaning that it is constantly changing, it's not very well defined, or it's not set at that moment in time. And there's a lot of examples where there's case by case, where decisions have to be made, and the variation is just very high. You may not want to use RPA because it gets very complex. And again, you may not be able to automate 70% of the logic. You may only be able to automate a small piece of that logic. And one of the things, again, to consider, if the app constantly is changing, where that on a monthly basis that things are just, again, the data may be changing, the UI may be changing, or that will require you to reprogram the bot, that is costly. So you may not want to use RPA to do the automation there as well. And the last thing we typically look at is the return on investment. If it's going to take, $100,000 to produce a complex bot, but the return on investment is only $20,000 for example, and you don't get the quality that you're expecting. So we very carefully as a COE actually look at that and make decisions on and prioritization on what gets pushed forward and what does not. So those are again things that we again one example of from the lessons learned that not everything should be using RPA for workflow automation. The second thing I want to highlight is part of the work that we do from a design standpoint is that when RPA runs, especially the unassisted ones where it runs at any point in time that you program it to, you have to create this non-human bot ID in the application. If you think about from a security standpoint, when we first did this, it was freaky. People were freaking out to say, oh, you're creating a kind of a dummy ID. It's not related to a human. How do we track, how do we monitor, how do we audit these things? So you kind of have to design that into your bot design. And again, one of the things that we put a lot of security on, we put a lot of controls on is who actually can access and actually even request for a bot ID, non-human ID. And it goes through multiple layers of approval. We actually have our SOX controls in place to ensure that, that those procedures are followed very closely and we're actually auditing them. And that we have to ensure that the IDs are truly active and being utilized. If they're not, we actually disable them very quickly. And the thing is the credentials, like the password and the actual ID itself, is only known by the business owner. IT does not know any of that information. We do not need to know any of that information. And it's all managed by the business itself. The other thing I'll mention is the monitoring. We actually put software monitoring on the bots so that we're actually seeing every activity that it does within the application. So we monitor, and that data is actually on a monthly basis reviewed by the business owner who owns that bot to ensure that if the bot is programmed to do A, B, and C, it's only doing A, B, and C, meaning that no one else is using the ID and doing something totally different. And we actually control that on the application level if possible, where the bot is only given limited access to what it needs from a data standpoint, from a capability standpoint, from a feature standpoint. So that's one of the lessons learned. Just really design that into your bot design up front. And as long as you follow that reference architecture, I think everything should be fine from a control standpoint. And then the last thing I'll mention is around bot resiliency from the lessons learned. I think when we first did our first few RPA projects, what we learned was that at times between dev, QA, and production, there are data differences, there are environment differences, and if the bot is not aware of that, it will work in one environment but not the other, and definitely not in production. And so we learned that lesson the hard way, where we actually had to go back and reprogram several bots to make it work specifically in production. So again, from a design standpoint, from a build standpoint, what you want to do is be able to have the bot intelligently, number one, identify what environment it's running in. And then based on that, it may handle things a little bit differently. It will definitely log in differently. It will definitely expect different type of data, the identified data versus actual production data. So it has that intelligence and what I call, again, bot resiliency. And the most important thing is exceptions. There are going to always be exceptions to the workflow. And I shouldn't say always, but very likely, your bots, again, handling 70 to 80% of the standard flow. And that exception, and how do you handle that? And when it doesn't recognize that standard, the bot needs to, again, fail gracefully, meaning it should not just stop. Because if there's a million things to process, it stops in the middle, it's a poor quality bot, right? What you want to do is take out the exception, actually and then log it, and then continue processing. And what happens at the end of the day is that you would then send the bot owner a report that says, here's all the exceptions. And those things may be, require either manual processing or fix the issue and then let the bot then pick it up the next day or the next time it runs. So I think that's pretty important to exception handling. I think the other thing I'll mention around, again, the bot resiliency is performance. One of the things that you should anticipate as you're building out the bots is understanding that, there may be network issues, there may be server issues that may slow down the performance. So again, your bot needs to be resilient enough to recognize that, okay, it's slowing down, so I need to maybe pause a little bit more in between steps, and then figuring how to do that and how long to pause. So again, a lot of it, again, as we implement, Ash talked about AI and ML, even with RPA, it will learn that, and it will actually start recognizing that and automatically build in that pause to ensure that the bot's trying not to get ahead of the application itself. And the last thing I'll say around resiliency is it's critical that we have this interactive communication where the bots are actually communicating these exceptions, communicating these issues to the bot owner, and the bot owner really carefully monitoring what is being done by the bot, and then monitoring, ensuring that it's doing what it's supposed to do and only doing what it's supposed to do. And the last thing I want to talk about is what the future state is for Kaiser Permanente around RPA. So if we go to the next slide, there's three things that maybe there isn't the next slide. Well, I'll just talk about, there's three things that we are looking forward to for RPA. One is we're going to create a citizen development program. So one of the things that we have is, again, we have 50 to 70 projects that we've done or in the process of finishing up. We have about 70, 80 bots running. So how do you now scale this? The COE can only do so much, but now how do you now expand the COE to enable folks like Ash's team or enable business partners who have very simple automation to actually be able to leverage this technology and to be able to develop their bots and provide especially very specific guidelines of things that they have to follow. And also the reference architecture, how they design their bots. And as long as they follow those guidelines, and we have to automate to ensure that those guidelines are followed, that we can then say it's ready for production. So it's really developing all those guidelines, the program itself, and then getting it spread and increasing the adoption of RPA utilization. The second thing I'll talk about is then the tools. It's not just a program. How do you make development of RPA bots simpler? I think Ash's team had done some already, and it can get complex because of the logic. It's coding, basically. But there are tools out there that actually will be like Excel macros. For those who have actually used Excel, I understand that if you open up a blank sheet, yeah, you're gonna have to do VB script, you have to do some coding. But there's also a function within Excel, and there's the same type of tools are available for RPA where you can actually say record my keystrokes, and it will then record it and generate initial set of code for you that says, here's what the bots learned from your keystrokes. And then from there, you can then modify it to say, okay, instead of hard coding this value, I want you to go get this value from somewhere else. So it speeds up the whole process. It actually simplifies it. So for folks who may not be coders are able to actually do some basic RPA automation themselves. I think the last thing we're going to do as we move forward is also to create what we call automation hub and dashboard. So you can actually see, how your bot's performing. You can do that today by getting these reports, but creating this hub, you can see how your bot's doing, the other bots in your organization, or even within your function and what they're doing, how they're performing. And potentially, and here's the vision, is that now that you can actually see what the bots are doing across the whole organization, you may want to say, I want to use that bot as well, and be able to take that bot, make a copy of it, and use it for your work, either as a starting point, and you can customize it, or just take it and use it and adopt the bot, and again, leverage the automation that was done already. So those are, again, some of what we're looking ahead for in not just, we're starting this year and start implementing in 2021 for RPA.